Good morning, mga suki. I am Mikey Mendoza, the current Vice President of the Young Pharmacist Group Makati Chapter, a graduate of BS Pharmacy of St. Louis University, Baguio City, currently a pharmacotherapy scholar of the University of the Philippines, Manila, and your Mercury drug pharmacist. I'm so happy to welcome you today to our Diabetes Care Lecture Series. Ngayon po ay nandito tayo sa Get Well at Mercury Drug Diabetes Care Corner of Mercury Drug Glorieta Branch. This specialty corner is like a one-stop shop for diabetic patients, as it features a complete and wide assortment of products such as sugar-free food items, clinical nutrition products, and diagnostic devices to manage diabetes. Aside from that, you may also seek specialized diabetes counseling from friendly pharmacists from us like me. We were trained by experts from the Philippine Society of Endocrinology, Diabetes, and Metabolism, or PSEDM, and the Philippine Pharmacists Association, or PPHA, so we can provide this specialized service just for you. Today, as we continue our commitment to educate and care for our sukis, handog po namin sa inyo ang isa pang Diabetes Care Lecture Series na libre ninyong mapapanood live through the Facebook page of Mercury Drug Corporation. I know, excited na kayo sa lecture series natin, so hindi na ako magpapaligoy-ligoy pa. We are fortunate enough to have medical experts with us today to tackle two important topics that are timely and relevant that every diabetic patient should know. The first topic is the art and science of preventing complications in diabetes. And the second topic is immunization, a critical part of diabetes care. Kaya mga suki, i-reserve nyo yung mga questions niyo to comment below this post. Don't forget to like, comment, and share this post to your Facebook wall. So let me introduce you our first speaker. Our first speaker is Dr. Maria Cecil Añenuevo Cruz from the Philippine Society of Endocrinology, Diabetes, and Metabolism. Dr. Cecil earned her medicine degree at the University of the Philippines, Manila. She also finished her residency and fellowship at the University of the Philippines, Philippine General Hospital. She's currently an active consultant at the St. Francis Cabrini Medical Center. Hello, Dr. Chi. Welcome to Get Well at Mercury Drug Diabetes Care. It's a pleasure to have you here now.
Good morning, Mikey. It's also a pleasure to be here. Thank you very much for having us.
Thank you, Doc. I'm sure, Doktora, excited na ang mga suki natin to learn more about the art and science of preventing complications in diabetes. Kaya mga suki, again, don't forget sa LCS natin, like this post, like Mercury Drug Corporation, comment your questions below, and share this post to have a wide range of viewers. So, huwag na tayo magpaligoy-ligoy pa, no? Let's start the lecture.
Good morning, everyone, and good morning, mga suki. It is my pleasure to be with you today, and I hope that at the end of this lecture series, we would be able to have more understanding about not only diabetes, but also how to prevent its complications. So for this morning, the topic would be the art of preventing complications in diabetes. If you notice, the call is art. It's not just an idea na lahat ay matutunan. There is also a fine-tuning to it, and we will be able to understand a little bit later on how we might be able to do this on a daily basis. And these are my disclosures. I do not have any disclosures for this particular lecture. And for this morning, we will be talking about some things pertaining to the complications of diabetes. First off, we want to be able to identify the complications of diabetes. Exactly what are these things? Maybe may idea na tayo based on personal experiences or maybe from our own relatives. We might also want to be able to understand it from the point of view of a medical person. And likewise, we want to be able to discuss how we might be able to discuss particular measures, especially with also our relatives or even among ourselves, kung paano natin maiiwasan yung complications. And likewise, be able to have an idea how we are able to treat the complications should they have occurred already. First off, we want to be able to understand ano yung symptoms ng diabetes. Maybe you have your own ideas as well. Some patients would probably already say na meron ganggang sa biwi. It's a very common finding, but some of the more common complications or the more common findings in a patient who might already have symptoms of diabetes would usually be weight loss. And weight loss that is unintended. Sometimes patients would say na hindi naman nila sinasadya, pero pumapayat sila. And it really is an alert symptom for us. Some of the other symptoms that are quite common as well would be frequent urination. It's not just having to go to the bathroom frequently, but also having more urine being voided every time a patient would need to go and urinate. Likewise, sometimes we also see patients who would also have problems in terms of thirst. Madalas silang kailangan uminom ng tubig. And it's not only because they only have to take it because it's very hot outside, but they are compelled kasi parang natutuyo. From where I come from, ang sinasabi nila, naiiga. And it's likewise something very common for us to know that these patients are largely chronically dehydrated. Likewise, we also sometimes feel that patients will have problems like non-healing wounds. They would complain na kung silang sugat na matagal na hindi gumagaling, especially kung nasa paa, farther from the heart, and likewise even more subject to the problem of complications. Likewise, some patients might be not aware of the symptoms of diabetes, or some might not even experience these symptoms, but most often you would see that the symptoms would usually correlate kung gaano kataas yung sugars nila. But we might always say na sometimes lang, because sometimes hindi naman talaga nagkakaroon ng symptoms, and the symptoms don't necessarily mean that they would always have elevated blood sugar, or sometimes the symptoms might not even be there, pero sobrang taas ng blood sugar. We move also to the complications of diabetes. We know that the complications do not occur overnight. Hindi yung pagising natin, may problema na tayo sa kidney or iba na ang paningin natin, but it's usually something that would occur over time. We know that the complications of diabetes are because of matagal na mataas yung blood sugar, so chronic hyperglycemia. And as a result, these particular patients are more likely to develop complications kapag ganun katagal na yung kanyang diabetes or pag ganun nakatagal na hindi controlled yung blood sugar levels. We also see that there are certain individuals who have a higher risk of having complications, and usually this would be because there are many other illnesses along with diabetes that would usually affect the way complications will occur. Mamaya titingnan natin kung ano yung complications. And in particular, if you want to be able to think about ano ba yung complications in diabetes, it is literally from head to toe. And if you would look at it, diabetes is not an overnight illness. Pag ininuman natin ng gamot, gagaling na tayo in a few weeks or a few months. Once you know that you have diabetes, we are not called diabetic. We are called persons with diabetes, and we would have to live with diabetes for the rest of our lives. But what we can do is we can actually adapt certain lifestyles and be able to follow the advice from our physicians, from our counselors, from our pharmacists, from our nurse educators about how best to control our blood sugars and how to live with it, and also be able to live along with the diabetes complications should they have occurred. But we know that because diabetes is a condition that will not be solved, it can only be controlled, the complications can occur after a long period of time. The patient wants to have diabetes will probably have complications the longer you have diabetes. And what are these complications? First off, you want to be able to understand it on the left panel. Ito yung mga complications that would usually affect the larger blood vessels in our body. And as you will be able to see here, the first will be coming from the head, is cerebrovascular disease. And ito po yung sinasabi ng nasan, bigla na lang ng hina, nangiwi, o kaya po biglang hindi na makalakad. Ito yung mga patients na posible na nagkaroon po ng stroke. And we know that stroke is not only caused by diabetes, but it is also quite frequent in patients who would also have diabetes. As you're also able to see here, another part that can also be affected is the heart. And likewise, in a patient na mayroong diabetes, you would usually see that these patients are more likely to develop sakit sa puso, and that's sakit sa puso because of the blood vessels being affected. Kumikipot, lumiliit yung daanan ng dugo at doon sa heart, and as a result, the heart, which is largely a muscle, would lack blood supply. At yun yung reason kung baga, minsan nagkakaroon ng difficulty sa paghinga, mabilis mapagod, minsan nagkakaroon ng problema, umakot ng hagdan, sumasakit ng dibdib, minsan hindi sakit ng dibdib kung hindi hapon lang. And as a result, this might be actually a complication of diabetes. As we are able to see on the right panel, it also can affect the eyes. And the eyes are very important because we know that in patients who will have diabetes, especially for those patients who will have had it for a long time, the eyes, specifically the retina or yung likod na parte ng mata where the nerves and the blood vessels are usually affected because there could also be problems. Ang tawag doon ay retinopathy. And when a patient has retinopathy, especially if uncontrolled, this could also lead to vision loss and likewise a change in their quality of life. Lastly, we might also say that there are also problems pertaining to even other smaller vessels, such as in the kidneys and also doon sa bintik, particularly the nerves. In the kidneys, we know that as you just go and look around, dumadami na yung mga dialysis center. And in any dialysis center, we can find that more than half of the individuals who are undergoing dialysis are because they have diabetes. And we know that diabetes affects the kidneys because diabetes, having had blood sugars that are uncontrolled over a period of time, can also cause changes doon sa ating kidneys kasi ang kidneys natin are largely blood vessels. And because diabetes can cause changes in the blood vessels in the kidney, it can also cause problems dun sa kaya na gawin ng kidney. You know that our kidneys would act like parang siyang filter, parang tagasala ng dugo natin. And when you have problems with this filter, yung mga bagay na dapat tinatapon natin or in-excrete natin, in your blood exam, you might also see that it's also called the serum creatinine. That's just one of the things that is in the filter ng dugo. If we would have problems in the filter, which is our kidney, we would have problems excreting this, and it would also be a problem in the long term because elevations in your creatinine could also cause problems. Other parts or other patients might also complain about difficulties sa pakiramdam sa paa. And some of these patients who would have that particular problem is called the complication of neuropathy. Neuropathy can be a symptom, pwede siyang maramdaman na parang pumutusok. So some patients would complain in the morning or as they wake up in the middle of the night, they would complain that there are pins and needles na parang may nilalamdam doon sa paa na wala naman na nandoon. Or sometimes they would also feel na parang medyo unusually mas makirot siya or mas sensitive. On the other hand, meron naman yung mga iba na hindi naman nakakaramdam or namamandig na talaga yung paa. This is a problem because we know that when you have neuropathy, it is also a problem because in patients who would have neuropathy, kung hindi na nakakaramdam ang paa natin ay maaari na masugatan na hindi natin nararamdaman. At kung hindi nararamdaman ito, maaaring ma-neglect and over time, hindi siya masyadong mapapansin at hindi na ito nagkakaroon ng pag-improve sa pagkagal. Some patients will also complain of difficulty in being able to take care of their wounds. So in patients na nagkaroon na ng sugat sa paa, kung halimbawa, hindi nararamdaman o kaya hindi na-detect ng maaga, ang mga ibang patients na meron ganitong problema, minsan nauuwi ito sa mas grabing infection. At yun siguro yung mga naririnig natin minsan, pag grabe yung infection sa paa, minsan nauuwi na kailangan operahan, o minsan, unfortunately, kailangan maputulan ng daliri o kaya ng pinky. Kaya yun yung mga bagay na ayaw din natin. And we remember that these important complications should be kept in mind because the idea is not only to detect them, but also to prevent them. Let's talk about the cardiovascular complications. And the cardiovascular complications of diabetes, if you would think about patients na may diabetes, kung kukumpara mo sila sa mga tao na kasing edad nila, na wala namang diabetes, mas mataas yung risk ng tao na merong diabetes. We know that as we all age, we will probably have these problems, but in a patient who would have diabetes, para siyang tumatanda na mas maaga. They would probably have these complications early on, which would largely cause not only heart attack, but also stroke and even death. If you would have that, you should want to be able to prevent it as well. And in patients who would have diabetes, the first two things that we want to be able to tell them are free things that we can be able to adapt in our own lifestyle. Libre. kasi hindi natin iisipin kagad the cause. And first off is, of course, if you are a smoker, you have to stop smoking. And it's not only because it's for your lungs, but it's also for your blood vessels and also for the other parts of your body that would improve, especially if you have diabetes. Another thing is also to follow a good diet. One recommendation would be to be able to decrease the fat content in our diet and likewise be able to decrease the salt content in our diet. So if you notice, may diabetes ako, bakit fat at saka salt ang pinag-uusapan? Di ba blood sugar lang kapag diabetes? But we want to be able to say that in a patient who has diabetes, it's not only blood sugar or sugars in the diet that we want to be able to concern ourselves with, but we want to be able to also see that in a patient who has diabetes, importante pa doon sa blood vessels din ang tamang diet in terms of yung fat content at salt. What's a simple way of being able to control yung fat content and salt? To be able to eat lean na pagkain. So obviously, kung nakikita natin na merong taba o kaya malat, especially kapag meat product, tatanggalin natin yun. It's enough na nagkaroon ng konting fat dun sa loob, kailangan natin ng konti din, but we want to be able to limit it so that it will not increase other problems as well, as we will be able to see later on. In terms of salt, para kang hindi Pilipino, kapag hindi nagtotoyo o hindi nagpapatis, o kaya ang kare-kare mo ay walang bagoong, but it doesn't necessarily mean that your diet has to be bland. It's just that for things na kailangan ng dagdag, katulad ng sausawan, you would tell them na kung paano natin ang pagkain, we want to be able to keep it that way. And if you would want to be able to have a little bit of seasoning, for example, kung salt man, kung patis, o kaya kung toyo, you have very little of it para at least minimize natin yung additional salt natin from the diet. You would also want to be able to assess other problems. So the first two things for free, lifestyle changes. The other things that we will be talking about later on are about testing or screening for complications. And one problem that we would usually find in patients with diabetes is that they don't only have blood sugar problems, but they also have cholesterol problems. And in terms of cholesterol, parang magpipinsan silang sakit. Once you have blood sugar problems like diabetes, you are more likely to have also problems with your cholesterol. In terms of your cholesterol, if you would have a cholesterol level tested, you would usually need to treat yourself, for example, with a medication, as you will see later on, because most patients with diabetes would also have problems with their bad cholesterol. In your laboratory test, it comes out na may mga iba-ibang tests, and one of the tests you would recognize there would be your LDL, or bad cholesterol. On the other hand, you would also have other cholesterol parameters included in your laboratory test. Kapag tinawag yun, it's called the lipid profile. And there are also triglyceride levels that you would also be able to see. And also there's also yung tinatawag na HDL, or your good cholesterol. If you would want to be able to lower your bad cholesterol, on the other hand, your good cholesterol or your HDL, you want to increase it as well. So if you want to be able to treat bad cholesterol, you want to be able to treat it not only with appropriate diet, you want to be able to also treat it in terms of medications. And the medications that are largely prescribed that will really make the most benefits for patients with diabetes is called a statin. So for patients with diabetes, if you look at your prescriptions, you might already have a statin in your prescription, and these kinds of medications are really dedicated to improve your blood cholesterol levels, specifically your bad cholesterol. But what we treat are not numbers. We want to be able to give this to a patient who will have cholesterol levels that are elevated, but we want to maintain it over time because we know that these changes, pag tinanggal natin ang gamot, tataas siya ulit. And we don't want to treat it just so you can get to your good goal and matutuwa tayo na pwede na natin makita na ang ganda na ng level. But we want to decrease your risk for heart disease. Kaya siya tinutuloy. And this is commonly prescribed in patients, especially those who are 40 years old and above, who have diabetes, so that if you have even low normal cholesterol levels, we want to be able to give this to these patients who have diabetes who are 40 years of age and older, because it decreases their chances of having other problems, including heart attack, stroke, and also death. We want to also be able to see that there are current recommendations on how, or sino yung mga patients that are best, or the most patients who would benefit the most from statins. And as you would be able to see earlier on, yung age na matter kasi lahat tayo, regardless if we have diabetes or not, would probably have other problems with our blood vessels as well that are also cholesterol related. But in addition to also has diabetes, you want to be able to give it for patients who already have cardiovascular disease. So sino yun? Yung nagkaroon na ng stroke, nagkaroon na ng heart attack, yung nagkaroon na ng problema dun sa blood vessels papunta sa paa, and these are the individuals who would largely benefit from maintaining a statin. Aside from that, even patients who have never had a stroke, tingin natin sa 40, bata pa, agree tayo doon, di ba? But even then, we know that if we want to prevent disease, even if hindi pa nagkaka-stroke or heart disease, we want to be able to give this to patients who are 40 years and older if they have diabetes in order to prevent these from occurring in the future. Aside from that, we might also see sometimes in a prescription for a person with diabetes na merong mga ibang naka-aspirin din. And this is a low-dose aspirin which is recommended to be taken about 80 milligrams per day. And it is usually recommended for patients who would have other additional cardiovascular factors, particularly if they have diabetes, if they are also suffering from other problems including hypertension, elevated cholesterol, or could also have problems with their weight who are particularly obese. And aside from this, we want to be able to also understand that it can help as a medication and also in order to prevent complications. But as a medication, we know that aspirin is a medication that could also make your blood thinner. Ibig sabihin, parang mas matagal kapag masugatan tayo, mas mag-bleed. So if you would have problems, particularly if a patient would undergo, let's say, dental extraction or magpapa-opera, or there would be other problems that would entail some amount of bleeding, or kung talagang nagkaroon ng bleeding episode na, or kung nagkaroon ng ulcer in the past, then these might be conditions that we might need to tell our doctor so that this particular medication might need to be discontinued temporarily or even permanently. If you would want to be able to look at how we want to be able to control diabetes, particularly blood sugar, we know that this is something that you would do hindi lang sa simula kung hindi tuloy-tuloy. And the goal for us is to be able to get to your normal, which means it's not the laboratory normal, but the one that is meant for you, that is prescribed or targeted for you. And the better your sugars are, the lesser your chances of complications as well. If you also want to be able to understand how it is that you would want to be able to control your blood sugar, we don't want it high, kasi sabi nga natin, it's correlated with complications, but we don't want it too low either. Yun yung tinatawag na hypoglycemia. Ibig sabihin noon, yung mga patients na pinagpapawisan ng malamig, nangangatal, it's not necessarily hunger, kinakabahan, minsan hindi makakoncentrate, kaya minsan hirap ng magising pa talagang tulog na tulog. And in these kinds of conditions, it might actually be because of hypoglycemia. And as a result, we want to keep a good balance, hindi gaano mataas, hindi rin gaano mababa. And for that particular target, we want it to be personalized. Even if we want to be able to target in general for a person with diabetes, blood sugar levels in the fasting state between 80 to 130 milligrams per deciliter, we want also to be able to tailor it depending on the patient's symptoms. Ano yung nararamdaman niya? And for that particular reason, some patients might have targets that are different from what we would also like here. In general, we want that as a fasting target, but after eating, we expect our sugars, of course, natataas, but to a certain extent as well. So that for patients with diabetes, the recommended post-meal or after eating sugar taken 2 hours after would be a less than 180 milligrams per deciliter target. And likewise, if we would have patients who would have problems, yung nararamdamang kakaiba, when we get them to these levels of blood sugar, we also want to be able to individualize their treatment targets. We want to be able to understand as well that some of the tests that you would have for patients would also be their HbA1c. And their HbA1c is actually a test that is taken from blood, and it is actually an estimate of your blood sugar levels in the last few months. So it gives us a good picture of how your blood sugars will go throughout a few months, because we know that if you just check a fasting blood sugar, you get to check at the time that you're not eating possibly reflecting what you have had experienced in the last few weeks or in the last few days. And this might not give us sufficient information to kind of control the blood sugar. And since we want chronic control, very good control over time, we want to keep your HbA1c levels at less than 7% in patients in general, but some patients might need to have their blood sugar levels, particularly their HbA1c, at a lower target, or even some patients might need to have it at a higher target. And that in particular would pertain to individuals who are older or individuals who would have other illnesses that would make them prone to hypoglycemia. You remember that hypoglycemia, as much as hyperglycemia, is something that we do not want to occur. And in patients who would have longer duration of diabetes, older patients, or yung mga patients na nag-stroke na, who might not have the typical symptoms ng hypoglycemia, or who might not be able to help themselves should hypoglycemia occur, or for patients who would have liver or kidney disease. These are the kinds of patients in whom we consider that hypoglycemia is quite common, and that the risk for hypoglycemia being very high should also dictate to us what kind of blood sugar target they should also be taking. We move on to the next, which would be our eye complications. And we know that eye disease is quite important because some patients might not even have eye examinations on a regular basis. But the current recommendation would be to start it at the time that the patient is diagnosed to have diabetes, specifically type 2 diabetes, and that if an individual would have no problems at the first consult with an ophthalmologist, then they would have been given recommendations as to how frequently they would want to be able to return to their ophthalmologist. This is generally, at the very least, every year. And you would want to be able to catch the disease early because there are many ways that retinopathy or problems with the eyes can be addressed. And of course, among them would be to be able to improve their blood sugars in the long term. You want to be able to understand as well that if a patient would have his eye exam at the onset from the time that he is diagnosed, he would now be told how frequently he would need to have his blood, his sugars, and also his eyes checked. So generally, it's at the very least annually. And in particular, if you would have a patient who would have an eye examination, it's not enough to get refractions. Ito yung typical na idea natin kasi pag nagpa-examine sa mata. Nagpasalamin na po ako, medyo marami sa lab, okay na po yun. So we know that yung sa eyes, diba, pag lagi nagpapatingin ng salamin, tinitingnan sa atin kung gaano kalayo yung nababasa natin kung malinaw pa. But that is not the problem in diabetes alone. What we want to be able to see is the retina. And yung retina, kinakailangan nun, hindi yung pagbabasa lang kung malinaw yung salamin natin or yung mata natin, but it entails an examination by an ophthalmologist. That would also mean that there are special reasons or special examination techniques that would have to be done para makita yung likod ng mata. These are painless procedures, by the way, so that a consult is not really something that we should fear. We want to be able to tell our patients as well to have good care. We talked a little bit about non-healing wounds. It's a problem in patients who would have blood sugar problems, but we also know that there are problems, particularly in patients with diabetes, particularly kapag yung pata nila ay hindi na nila nararamdaman masyado. One sure way of being able to tell na may problema sa neuropathy o yung hindi na nakakaramdam or may nerve disease is kapag naglakad ang pasyente at naiwan niya ang tsinelas niya na hindi niya alam. So kapag nangyayari yun sa atin or kapag ang ating lola or ang ating loved one ay nagkaroon na ng ganyan problema, we really want to be able to tell them to take care of their teeth. And one way by which we are able to take care of our teeth is by regular foot inspection. And we want to be able to do this on a daily basis by telling them that at the end of the day, pag natulog na sila, tingnan ang paa. Kung nahihirapan dahil malayo, kaya nahihirapan tumiklop ang katawan, we can use a mirror, o kaya we can ask someone else to do the inspection for us. We are looking for things like cracks, new wounds, pag nagbagong sapatos, kapag nagkapaltos, yung areas na namumula. And these are things or indications na baka may problema tayong nagsisimula. And if we want to be able to prevent further disease or further problems later, should these be found? Halimbawa, nagka-crack yung paa, namamaga, nagkaroon ng sugat na parang ang tagal ng gumagaling, Kaya parang mainit, kahit walang sugat lang, pero mainit yung pagtinion. We want to be able to consult early before problems also occur. We want to also be able to see patients upon their visit in the clinic for their teeth. Kaya huwag kong magtataka kapag ang doctor ninyo, pinatanggal sa inyo yung medyas ninyo at sapatos ninyo kapag kumonsulta, kasi importante po yun. Huwag pong mahihiya. Kailangan po namin makita yun because we really want to be able to assess holistically if you have any problems, especially in terms of yung pakiramdam sa paa or yung blood flow sa paa. And this examination is not only done within the clinic consult, but a formal examination by certain procedures also have to be done at the very least annually. Ito po yung mga tests na ginagawa lang sa clinic. Pinapakinggan namin, tinitingnan namin kung ano po yung nararamdaman sa paa using a small filament, or sometimes pinukuhanan po ng parang blood pressure doon sa binti at sa arms para malaman namin kung kumusta yung blood flow doon sa paa. In terms of kidneys, we know that patients with diabetes are at risk for having kidney problems, and that sometimes you might be asked by your doctor not only to have a blood exam for your creatinine, but also to have a urinalysis for some special tests with your urine. And these tests will actually tell us if there is protein or albumin in your urine, which are very early signs of problems in terms of the patient's functioning kidney. If you would have that as a problem, even if konti pa lang yung albumin sa urine, pwede pa natin magawa ng paraan. And there are certain medications that you need to take in order to prevent these problems from progressing. And what are those things? If a patient is also hypertensive o mataas ang blood pressure, then there are certain antihypertensive medications that have to be given to them. If you would want to be able to look at them, or maybe if you are the person with diabetes who want to look at your prescription as well, you might already be on it. It's called an ACE inhibitor or an ARB or an angiotensin receptor blocker. These are the medications that are ending in pril sa dulo o kaya yung sartan sa dulo. And as antihypertensives, they don't only get your heart or your blood pressure to normal levels, they also help your kidneys in the long term. And the idea is to take them for as long as it is tolerated. And the reason for this is that we know that the risk also increases as we age, and that it will not disappear, kaya tuloy-tuloy pa rin ang medication. Another problem is that hypertension can largely occur with patients with diabetes. And usually, if not 60%, baka 80% ng diabetes patients ang meron din ganitong problema. And we know that in patients who would have hypertension, that alone would already predispose or make an individual at risk for other problems. But if they go together, mas mataas yung chance to have problems with the heart and the blood vessels, and even complications with the kidneys and the eyes. And we know that hypertension is a condition that is chronic, and that if you would have problems with hypertension, they have to be treated. And we define hypertension with blood pressures of 140/90 or more. So that, kung ang individual sabihin, okay lang naman po ako, 150/90, komportable ako, wala akong nararamdaman. It has to be said that dahil mataas na yung BP, kailangan pa rin siyang gamitin. And the reason for this is that there are certain recommended target blood pressures for patients with diabetes and hypertension. And we would generally recommend that the blood pressure should be 140/90 or less. And likewise, for individuals who are even at higher risk, especially yung sinabi natin kanina na meron ng protein sa kidney, o kaya mas mataas yung risk na magkaroon ng problema sa heart, these are the kinds of patients who need to target their blood pressures to an even lower level of less than 130/90. We want to be able to monitor our blood pressures as well over time. And in order to also not only control our blood pressure using medications, we want to also lower our blood pressures by other means that we can also adapt on our own. First off is, of course, for individuals who are overweight or obese, depending on yung assessment po sa inyo, we want to lose a little bit of weight. Hindi kailangan pong pumayat ng payat na payat. We want to be able to reduce your weight by something about 5 to 7% from your baseline. Hindi nagmamadali, 6 months and the usual, because you want to be able to help not only your blood pressure, but also other parameters, including your cholesterol and your sugar level. Exercise is a good way of being able to also improve your BP. Hindi all the time na porket high blood, bawal mag-exercise. In fact, we want to be able to give you medication so that you will also be able to exercise. Of course, there are certain individuals who would have a limited capacity for exercise, so that the prescription for exercise would now also be dependent kung anong kaya nyo at saka kung anong gusto nyo gawin. Likewise, we would also want to recommend lessening salt in our diet. We talked about it a little earlier on. And you also want to be able to maintain the recommendation na hindi na dapat naninigarilyo. And in some patients na nagtatanong, pwede pa po ba akong uminom ng alak? And then likewise, we also want to maintain that recommendation that as much as possible, if you are not a drinker, then don't start. And if you are a regular drinker, you want to also decrease your alcohol intake. Masama din po yung minsan-minsan na nalalasing. Kasi hindi rin po natin gusto yung tinatawag na nag-binge drink. No? Dahil minsan lang naman, okay lang na yun. Because we know that there are also problems, especially in patients with diabetes. We also want to be able to tell our patients that the medications for hypertension, just like your medications for diabetes, have to be maintained because these are medications that will really control your blood pressure for a long period of time. And all medications, whatever they are, would have kasama ng mga nagde-react. So sasabihin na, yung side effect ko kasi kaya ayoko niyan. Kaya nakakasira po ito sa aking bato. Kaya hindi ko kaya masamayan sa atay ko. We will not give medications that will harm, but there are patients who would probably also have some adverse events, and we would need to discuss it with you as well. And if you would have these adverse events, or medyo may mga side effects na nararamdaman, you could readily tell your doctor about it para mamodify it. We want to also be able to say that there are certain individuals with diabetes who are still in the reproductive age na mabubus pa. So, importante po na ang patient na mayroong diabetes na gusto pang mabuntis, kailangan before they get pregnant, we have to have good control with their blood sugars before they get pregnant, because it also is important in terms of kung yung magiging outcome, kung magiging healthy si baby. We know that there are certain problems if the patient will have elevated blood sugars kapag sila po ay nabuntis, kaya gusto po natin na matikirin po yung blood sugars nila. And this also goes as well for certain individuals who just happen to have diabetes at the time that they are pregnant. It is quite important for a healthy pregnancy to maintain their blood glucose levels as they are pregnant. And we also know that there are certain conditions that are likely to occur in a patient with diabetes, including infections. And these infections are largely because patients with diabetes usually have difficulty fighting off infection, lalo na kapag mabalik sa sugar. And as a result, some of them are more prone to certain illnesses such as pneumonia or even other problems such as urinary tract infection. And one way by which we are able to prevent it is not only to improve our blood sugar levels, but also to have certain preventive measures, including vaccination. And later on, we are fortunate to have Dr. Joel, who will also be talking about vaccination, especially in the patient with diabetes. And we know that vaccinations are life-saving because they prevent complications or prevent illnesses that could be very severe. And one of them is pneumonia. This is the recommendation for patients who would have diabetes and also for other individuals who are adults. And later on, it would be dwelled on by Dr. Joel, particularly kung ano yung mga recommended vaccinations. That being said, we want to be able to tell everyone that if you already have diabetes, no matter how long or how short the duration, complications can be prevented because these complications can largely be easily detected and can be controlled with existing medications. But we also know that sometimes when they have already occurred, we can prevent them from progressing or getting worse. And what we also want to be able to tell patients is that yung bagay sa ibang tao, lalo na sa kapitbahay natin, o sa kaibigan natin, or sa friend natin sa Facebook, hindi necessarily bagay sa inyo. And that individualization is always the key. You are your own person. Create tayo differently so that you have your own targets and you have your own needs as well. So having said that, I hope that we were able to show you what the different complications of diabetes are and hopefully inspire you as well to get to know more about these kinds of problems so that you will be able to prevent them in the long run. Thank you very much, Nanasi.
Thank you very much, Doctora, for that lecture. I know talagang hinighlight ninyo yung talagang lifestyle change. Yung talagang pinaka-important talaga. So, mahirap, pero kailangan talaga.
Pinaka-mahirap.
Yes, lifestyle change talaga. Yung smoking, quitting smoking, and quitting alcohol. So, I already received a full of questions from our viewers. So, to start up, I have my own question. To start with my own question. In the community setting po kasi, being the most accessible healthcare practitioners, pharmacists, I see na nahihirapan talaga yung mga patients sa adherence, medication adherence, compliance when it comes to medication because diabetes is a lifelong disease. Ayan. So, Doctor, what advice would you give to your patients or to the pharmacists watching right now kung paano yung mga convince yung patient to stick to their medication?
I think maganda yung tanong mo kasi kayo nga yung mas karaniwang mas nakakausap nila in terms of those problems. First one, I think, is to make it personal. Kasi diba ang Pilipino very personal. So kung nagtatanong sila sa inyo tungkol din sa kailangan ko ba talaga ituloy ito, yung medication ito, isipin natin na para sa kanila yung ginagawa natin, para din sa pamilya nila. So minsan, tinatanong namin, so paano po kayo, ba kaya natin ginagamit ang ating sarili para maging tayo, kaya mas maganda yung ating pakiramdam, para mas makakatulong din tayo sa ating pamilya. So gawin siyang personal. Alamin natin kung ano yung motivation. Pangalawa, kailangan natin makakita din sa kanila na ang paggagamot in terms of medications for diabetes, for hypertension, for cholesterol, these are medications that will have to be taken for a long period of time, not because we just want their blood sugar levels to decrease or their hypertension to improve, but because we want to prevent complications. Kung nagkaroon ng complications, kung gastos ang yun ang inisip natin, mas magastos ang complications. So that a little every day in terms of hypertension, in terms of diabetes medications or cholesterol medications, they are actually very, very good investments. Kumbaga parang nag-info ka ng konti-onti para maiwasan mo yung mas grabing complication na mas mahal.
Thank you very much, Doc, for that, for answering my question. Now, from Sunshine's viewers siya sa ating FB Live, ang tanong niya po ay nagagamot po ba ang diabetes?
Masasabi natin na nagagamot siya in terms of nakokontrol, pero hindi siya mawawala. There are certain forms of diabetes that are temporary. Ito po yung tinatawag na gestational diabetes. For example, yun yung diabetes na habang nagbubuntis lang, tapos mawawala siya after mag-deliver. O kaya may ibang mga diabetes po na dala po, let's say, ng medications or ng acute illness, for example, that could also go away. But the more common forms of diabetes, especially type 2 diabetes, would not really go away. It's something that you would have to live with. And that the medications we are taking are not only just para ma-maintain yung blood sugar, pero hindi naman talaga mawawala ito, but in order to prevent complications.
Another question from our viewer is, bakit maraming gamot nire-reseta kapag diabetic?
Karamihan po kasi, siguro ang magandang nasasagot po natin dyan ay kapag meron tayong diabetes, mas karaniwan na kasama pa yung ibang mga napag-usapan natin ng sakit. So you would usually have also problems with hypertension or cholesterol. And for these individuals, talagang kailangan all the medications pertaining to the individual na illnesses, kailangan meron. So that in a patient who would have diabetes, it's very, hindi talaga ganun ka-common. Kasi kinakailangan natin gamutin isa-isa yung mga problems na kasama. It's not so much na gusto lang natin na maggamot kayo, pero ang gusto natin is so much na ma-prevent natin yung disease from progressing or from complications.
Doc, another question. Mas severe po ba ang diabetes kapag nag-insulin?
Sometimes, sabihin natin na ang patient kailangan mag-insulin for many reasons. And it doesn't necessarily mean na mas malala na siya. Sometimes, patients are put on insulin because that would be the best medication to control their blood sugar, especially if they're coming into the hospital na kailangan meron talagang need na mapaganda yung blood sugar nila immediately, and that oral medications for diabetes may not necessarily work at the time dahil nga nagsilang yung panahon kailangan makontrol agad yung sugar. For some individuals, tumatatang kasi sa isip na kapag insulin, parang last na siya. Wala na ibang option kung hindi ito na. While it is true that insulin is the most effective, we also know that sometimes meron mga reasons kung bakit hindi nabibigay yung mga ibang oral medications or hindi maaaring ibigay. Minsan may mga ibang nararamdaman yung pasyente na hindi yun bagay sa kanila, or meron silang mga ibang illnesses na hindi na sila pwedeng hindi dito magtutulong. Kaya minsan mga kailangan ng insulin. But you have to be able to maintain and hindi ibig sabihin na malala na, or is worse yet, yung iba sinasabi sa akin, mamamatay na iba kasi naka-insulin pa.
Okay. Since we've talked about foot care, the importance of foot care when it comes to diabetes, Margie Paranaque asks, ano po ang magandang sapatos for diabetes?
Hi Margie, most of the time, hindi talaga yung fashionable necessarily because we know that yung mga well-fitting na shoes for diabetes have not to be yung katulad ng puso ngayon na makitid sa harap. Ang tinatawag po doon sa entrada o yung toe box, no? Medyo mas malaki po dapat at medyo mas malapad. Importante yun kasi kailangan yung mga daliri sa loob, ay tama yung dapat, hindi yung ipit na ipit. Kahit na po hindi ganun ka-fashionable, pero hindi talaga yung kailangan. Another is that, hindi siya kinakailangan malambot na parang fluffy. Kailangan well-supported yung mga buto sa paa, so that most often we would tell them that yung sensible shoes ay yung malakad, yung toe box, yung entrada, tamang-tama, hindi makapot, at saka well-supported din yung heel. Hindi po talaga magandang idea, karaniwan ang chinelas, kasi alam natin na mas madali itong mapasok din talaga ng, let's say, nakatapang tayo ng isang bagay na pwedeng makasulat.
So, Doc, from Linda of Makati, ano po ang pwedeng gawin para maiwasan ang complication ng diabetes?
Katulad ng napag-usapan natin din, importante talaga na hindi lang blood sugar yung titignan natin. Yung pagtagal ng diabetes at yung pagtagal ng pagtaas ng blood sugar, isa pa lang yun sa mga ideas natin na gusto natin makontrol o mapababa. Yung mga ibang problems pa na kasama ng diabetes na very common, katulad ng hypertension, katulad ng pagtaas ng cholesterol, at yung mga ibang bagay na habits, katulad ng pagmamagalilyo, o kaya pagminom ng alak ng madalas, o kaya yung ating timbang, yun yung mga bagay na gusto natin makontrol para maiwasan natin yung complications. At yung control doesn't mean itong New Year's resolution na bawat 3 months lang, tapos nawawala na, buong buhay, buong taon.
Talagang early detection is important when it comes to diabetes. Then, from Mike of Pasay, totoo po ba na ibang herbal medications ay pwedeng makasira ng kidneys?
Kailangan natin isipin din na hindi porket natural or herbal ay pwede na out safe na sa katawan. May mga ibang tao na hindi maaari talaga na mabigyan ng mga ito kasi alam natin na meron na silang difficulty na ilabas yung mga certain substances kahit na hindi na masamang substance to their kidneys or even to their liver. So that generally, we would not recommend na uminom lang ng basta-basta, kailangan talaga i-consulta ninyo sa inyo sa inyo.
Please don't self-medicate. That's important when it comes to managing diabetes. So, Doc, we've talked about managing hyperglycemia. Now, from our viewer in our Facebook Live, tinanong niya po, ano po ang pwede gawin pag nag-hypoglycemia?
Una sa lahat, ang hypoglycemia, minsan nararamdaman lang po. Katulad ng mga sintomas na napag-usapan natin. So kung meron po nito, maganda kung na-check po natin, pero kadalasan hindi natin na-check ang blood sugar. So kung meron po tayong sintomas, ang una po natin gagawin, kung busy yung tao po, ay iinom po ng isang bagay na liquid po na merong asukal. Na pwede po itong half lang na cup, katulad ng juice, yung regular lang na juice. Kahit po paminsan-minsan, kailangan natin po ito dahil na life-saving ito. O kaya po pwedeng regular soda, pero half cup lang, hindi po diet soda. So wala po tayong magkakawang asukal po doon. May mga ibang tao, pinapatimpla po ng asukal sa tubig, pwede din po yun. Liquid ang pinakamabilis. Kung walang pagkakataon na gano'n, katulad po ng mga candy o kaya chocolate, kahit 3 piraso, pwede po naman yung baligid. Pero yun na nga lang po, medyo magtatagal ng konti kasi kailangan muyain o kaya tinawin pa. Pero yun lang yung mga bagay na for the time, din bumaba, pwede. Pero hindi po siya karaniwang pwede.
For our last question po, we've talked about yung retinopathy. Kasi when retinopathy, when we talk about retinopathy, very subjective siya. Yung patient na talaga nakakaalam. So, when should a patient have a check-up? Kasi tinanong ating viewer, kailan po ba dapat magpa-check-up ang mga mata kapag may diabetes?
Kung dati na po tayo may diabetes, no? Importante po na nakakapag-check yung pinakamadalang na po, tapon-tapon. At kung halimbawa, never pa tayo nakapagpa-check po, tapos talaga po, na pinapuna, may diabetes ako, kailangan ko ipa-check, ngayon na po. Pero what you would usually recommend is from the time na nalaman na may diabetes, so magpapacheck, and then kapag nakapagpacheck, sasabihan po ng kanyang ophthalmologist kung gaano kadalas. Pero dahil madalang na lang po yung usual na recommendation na annual, ang pinakamaganda pong ma-recommend ay tuwing birth month po ninyo. Para hindi niyo po makalimutan. Wala nakakalimot ng birthday. So para na rin po sa sarili po ninyo, birth month po.
Birthday. Important yan. License natin, birthday natin. So, very important na magpa-check up tayo every birthday natin. Now again, thank you again, Doc, sa magandang lecture. I'm sure marami natutunan yung viewers natin. Kaya sa yung mga suki, huwag yung kakalimutan mga reminders ni Doktora para maiwasan po ang mga diabetes complications. So, isa sa mga sinabi nito ay mas prone sa infections gaya ng pneumonia ang mga may diabetes. Ang mga infection na ito ay may iwasan through vaccination. Kaya, mga suki, don't fear vaccination na. It's very, very important. Kaya naman po, very fitting ang ating next topic, which is immunization, a critical part of diabetes care. And again, we're very lucky to have an expert pulmonologist with us today, Dr. Joel Santiago, to discuss this topic. Dr. Joel is currently practicing at the Philippine General Hospital. Hello, Dr. Joel. Welcome po sa Get Well at Mercury Drug Diabetes Care. Thank you po for accepting our invitation again. Last April po, I know you also did one of our diabetes care and immunization lectures.
Magandang umaga at it's a pleasure na makabalik dito at matulungan at maturuan natin ang ating mga pasyente sa kanilang mga concerns at katanungan tungkol sa hindi lang sa diabetes, kundi pati sa pagbabago ng mga pasyente.
I'm sure po that our Suki will find your lecture engaging kasi marami naman po kami nare-receive na inquiries tungkol dito. Kaya, mga Suki, again, I'm reminding you to please like this post, share this post, and leave a comment below for your questions, and we'll sure answer it after the lecture. So our lecture is about immunization, a critical part of diabetes care.
So, maganda pong umaga ulit at sa umagang ito ang ating pag-uusapan ay yung pagbabakuna. No? Hindi kailangan po natin unang matandaan o maintindihan na ang pagbabakuna ay nararapat o importante at magandang magawa o maibigay hindi lang sa mga pasyenteng may diabetes. Maraming indikasyon, no? Maraming mga klase ng sakit at kahit na yung edad ng pasyente na kung saan nararapat o maganda at makakatulong na sila ay mabigyan ng pagbabakuna. So, mamaya dadaanan natin at pag-uusapan pa natin ito ng mas mabuti. Ngunit titingnan lang natin, ito yung mga pag-uusapan natin. Ang tungkol sa pagbabakuna, ang paghalagahan ng pagbabakuna at lalo na yung kahalagahan ng pagbabakuna sa mga pasyenteng may diabetes. So, unang-una, para ating mas maintindihan, ang pagbabakuna, ito ay isang uri ng paggagamot o isang uri ito ng gamot na ang pinaka-ginagawa o nagagawa nito ay mapalakas, mapaganda ang resistensya upang hindi magkasakit ang isang pasyente. Pupuntahan muna natin yung immunity na tinatawag. Magandang maintindihan natin na ang mga tao, para magka-protection laban sa isang sakit, kadalasan nakukuha nila itong sakit na ito. Pero sa pamamagitan ng pagbabakuna, ang nangyayari dito ay parang i-advance mo or iti-trigger mo na mag-develop ng immunity o protection na hindi nadadaan sa pagkakaroon ng sakit. Halimbawa, measles, di ba? Malaking issue natin yan recently. Maraming mga bata, kahit na may edad, kahit na mga buntis na nagkaroon ng measles. Ngayon, ito yung natural na course na magkaka-measles ka, mararamdaman mo yung mga sintomas na isang may measles, kasama na yung mga rashes, at gagaling ka ito. Ngunit, Ang hindi natin gusto rito ay unang-una makakahawa ka o maaari kang makahawa sa ibang tao. Pangalawa ay yung mga potential or maaaring komplikasyon ng measles. Halimbawa sa pagbubuntis o sa mga may buntis, pwede silang makunan o malagdagan ng bata. So, yan yung natural course ng isang sakit. Ngayon, ang ginagawa ng vaccination or pagbabakuna ay uh, makikreate o madedevelop itong immunity na to na hindi mo nadadaanan yung pagkakaroon ng sakit na yun. So, kaya mas maganda pa rin talaga at nararapat na magbigay ng vaccination para sa mga sakit na kung saan na-develop na yung vaccination upang magkaroon ka ng protection na hindi nadadaanan ng sakit na to. Isa rin magandang maintindihan natin na ang vaccines o ang mga bakuna ay gawa sa usually fragments or parts ng isang virus o bacteria. O kaya yung mahinang klase ng virus or bacteria kung kaya hindi ito magti-trigger ng natural or sakit na nakikita natin sa community or sa labas. So, magkakaroon siya ng protection dahil matitrigger ng vaccine yung immunity pero hindi magkakaroon ng sakit. At kadalasan, ito ay binibigay sa pamamagitan ng injection. So, ini-inject yung vaccination, pwedeng minsan lang, pwedeng ilang beses, at pwedeng ulitin pa ito after several years upang mapanatili o ma-maintain yung protection ng vaccination ito. Ngayon, kanina napag-usapan na ng husto, pero dadaanan lang natin ang mabilis ang diabetes or ang sakit na diabetes. Ito ay isang sakit na kung saan ang katawan ay hindi nakakapag-produce ng sapat na insulin na ito kasi yung kailangan para makontrol, mapigilan na tumaas na husto yung asukal para magamit ng tama ng katawan yung asukal na ipinapasok, yung kinakain. So, ang sakit ng mga diabetes ay hindi sapat yung insulin na pinoproduce ng kanilang katawan. Ito ay maraming maaaring maging komplikasyon. Katulad nga lang, nasabi na ni Doktora kanina, kasama sa mga komplikasyon ay pagkakaroon ng sakit sa puso. Maaaring hindi mo maramdaman na sumasakit ang dibdib mo o sa bigat ng dibdib mo, pero kadalasan, lalo na tumatagal ng diabetic, malamang sa hindi may bara na yung ugat sa puso niyo. Pagkabulag, lalo na yung laging mataas ang blood sugar, tendency is nagkakaroon ng mga panibagong ugat sa mata na kung kaya hindi naman dahil nasisira yung mata kung di natatakpan itong mga ugat na to, yung paningin kung kaya lumalabo yung paningin ng isang pasyenteng may diabetes. Isa pang long-term complication ay yung sakit sa bato, especially yung mga matagal na 10-15 years ago na may diabetes at lalo na kung hindi nakokontrol yung blood sugar nila, maaaring pakonti-konting masira yung bato at ang magiging long-term complication nito ay maaaring kailanganin na palitan ang inyong bato or ma-dialysis kayo dahil sira na at hindi na nagpa-function ng tama ang inyong bato. Isa pang komplikasyon ay sakit sa baga. Isang kailangan maintindihan natin, isang dahilan kung bakit lagi at marami pa tayong pasyenteng may tuberculosis ay dahil sa diabetes. Ngunit hindi lang tuberculosis ang maaring komplikasyon ng diabetes, kundi pati ang pagkakaroon ng pulmonya. Innately or natural na mas mahina ang immunity ng mga pasyenteng may diabetes kung kaya't mas madali rin silang mag-develop ng pneumonia. So yan, ang mga taong may diabetes ay mas madaling kapitan at mahawaan ng infection. So hindi lang infection sa baga, kahit UTI, may tendency na mas madali silang magkaroon ng infection. Ngayon, bakit kailangan magpabakuna o ano ang kahalagahan ng bakuna sa mga taong may diabetes? Na-mention na nga o nabanggitan natin kanina na ang katawan ay humihina at mas mababa ang resistensya, mas mababa ang immunity ng mga pasyenteng may diabetes kahit na ito ay kontrolado. Kahit na may mga gamot na para makontrol yung blood sugar, comparatively or kumpara sa mga walang diabetes, mas madali at mas mahina ang kanilang immunity. Isa na dito ay ang pagkakaroon ng trangkaso. So, hanggat maaari, especially pag more than 50 years old, at lalo na kung may mga sakit na halimbawa, hindi lang diabetes, kundi may sakit sa puso, sakit sa baga, sakit sa bato, mahina ang immunity, hanggat maaari, ina-advise natin na mabigyan ng vaccination against flu kasi ito yung pinapangambahan natin, yung tinatawag na flu pandemic na maaaring maraming magkasakit at maaaring mamatay kung ito ay lumabas anytime soon. Ngayon, kailangan natin maintindihan na ang mga diabetes, especially, pag magkasakit sila, halimbawa magkatrangkaso, tumataas ang sugar nila in response dun sa infection. At sa pagtaas ng sugar na to, again, yung risk ng complications at tumataas din. Hindi lang trangkaso ang madaling makuha at maging problema ng mga diabetic, kahit hepatitis B. Kumpara sa mga walang diabetes, mas marami rin may diabetes na nagkakaroon ng hepatitis B. Isa pa, ang pagkakaroon o nasabi na natin kanina, yung risk ng pneumonia at yung mga kasama o kapatid na komplikasyon ng pneumonia katulad ng infection sa dugo. So yung pulmonya kumalat na umabot na sa dugo o umabot sa utak, ito ay maaari rin makuha at masagap ng mga pasyente ng diabetes. Ang isa pang issue o isang dahilan kung bakit mas magandang mabigyan ng vaccination ang mga may diabetes ay upang mabigyan ng dagdag na protection ang mga pasyente ito, ang mga tao na ito, laban sa infection. Patibayin, palakasin ang kanilang resistensya. So ito po ang ilan sa mga bakuna na pinapayo o ina-advise para sa pasyente may diabetes. Isa na dyan yung pneumococcal vaccination na para malabanan yung strep pneumoniae bacteria na isa sa mga pinakamadalas na dahilan ng pneumonia. Ang influenza vaccination na yung panlaban sa trangkaso, ang Tdap o yung tetanus, diphtheria, and pertussis vaccine. Kadalasan sa mga bata, ibinibigay ito, ngunit kahit sa matatanda, para lang maiwasan na ang mga nasa paligid nila ay magkasakit, binibigay din ito. At hepatitis B and herpes zoster vaccine ay ina-advise at ipinapayo sa mga pasyente may diabetes. Pag-uusapan natin ang mga vaccines na ito, ngunit kung may dagdag na katanungan kayo later, mas maganda mapag-usapan pa natin. So isa sa mga madalas at pinaka-importanting bakuna laban sa para sa mga pasyenteng may diabetes ay ang influenza vaccine. Ang influenza vaccine, kadalasan yan ang pinagsisimulan ng maraming sakit o maraming komplikasyon. Lalo na sa mga pasyente namin as a pulmonologist, yung mga pasyente na nagkakatrangkaso, ito rin yung mas prone na magka-pulmonia later. Kasi nga, mahina na yung immunity, halimbawa ng mga may edad or ng pasyente may diabetes, nagtatrangkaso sila, lalong babagsak yung immunity nila at mas madali silang makasagap ng pulmonya. Iba pang komplikasyon ng trangkaso ay myocarditis o pamamaga, infection sa balat ng puso, encephalitis at meningitis kung saan namamaga ang utak o ang balat ng utak, myositis o yung pamamaga o infection sa muscle ng katawan, multi-organ failure o yung nagsha-shutdown, hindi lang isa kundi iba't ibang organs sa katawan, halimbawa bato, baga, utak, puso, nagsha-shutdown sila ng sabay-sabay, at sepsis or bacteremia kung saan ang infection hindi lang nasa baga halimbawa kundi pumunta na rin sa dugo at mas delikado ito kasi ibig sabihin umiikot sa buong katawan ng infection at mas prone or mas may risk na makamatay. So, nasabi na natin o nabanggitan natin na ang trangkaso ay nakakapagpalala o nakakapagpataas ng sugar ng isang pasyente. Ngayon, isa lang pong gusto nating maintindihan ninyo at maaari magtaka kayo, ngunit hanggat maaari, ina-advise o pinapayo namin na ang flu vaccination or influenza vaccination ay dapat na ibinibigay yearly. At ito ay dahil sa ang influenza virus ay masyado mautak, mabilis siyang mag-mutate, mabilis siyang magbago. Kaya kung kaya't ang mga vaccine developers naghahabol na every year, pinipredict nila yung malamang na magde-develop lalabas na flu strain for next year at yun yung kailang gagawin o lalabas. So, kailangan magbigay ng vaccine every year kasi nagbabago rin yung influenza virus. Kaya, ang isa pa kung gusto na lang natin maintindihan nyo, iba ang influenza vaccination o ang influenza virus sa H influenza na sakit or H influenza na bacteria. Ang H influenza or Haemophilus influenza ay isang bacteria. Ang influenza A, ito ay isang virus. Ang influenza A, ito yung pinapayo natin na ibigay ng regular as a vaccine. Meron ding vaccination for H influenza usually sa mga bata ito ibigay. Ngayon, ang isa pang importanteng bakuna na ipinapayo namin sa mga may diabetes ay ang pneumococcal or strep pneumonia vaccination. Nabanggit na natin kanina, ang streptococcus pneumonia ay isa sa mga pinakamadalas na dahilan ng pulmonya sa community, sa labas ng hospital. More than 30% ng pneumonia ay dahil dito. At ang isang issue with your strep pneumonia is maraming pagkakapatid ito. Maraming tinatawag na serotypes or strains ito na pwedeng mag-cause ng pneumonia. More than 90 strains. At hindi lang pneumonia ang mga pwedeng maging epekto nito pag nasagap po. Kasama na rin dyan ang infection sa tenga, infection sa sinuses, pwedeng infection sa utak, at infection sa paligid o sa buong katawan. Pero ang mas pinakababantayan natin ay ang pulmonya at meningitis. So, kaya nga pinapayo na namin na magbigay ng strep pneumonia vaccination kasi hindi lang pulmonya ang maproprotekta nito, kundi makakaprotekta rin nito o mapreprevent din nito ang paulit-ulit na otitis media o infection sa tenga, paulit-ulit na tonsillitis and sinusitis at meningitis ay pwede rin maiwasan. Ngayon, tutukan lang natin ang pulmonya. Kailangan nating hanggat maaari na dagdagan ang proteksyon ng mga taong may laban sa pulmonya kasi makikita o mapapansin natin na sa PhilHealth, ang pulmonya ay isa sa mga pinakamadalas na dahilan kung bakit na-hospital ang mga Pilipino at kung bakit nagre-request o hinihingi ng tulong sa PhilHealth or ng claims or benefits sa PhilHealth. Ang pulmonya kasi ay pangatlong pinakamadalas na dahilan ng pagkakasakit. Lalo na kung ang isang pasyente ay ma-hospital, kunyari, ma-hospital dahil sa may problema sa puso, sakit sa puso, sakit sa bato o diabetes man. Kung magtagal sila sa hospital, maaari makasagap sila ng pulmonya doon at maaari ito ay maging dahilan upang sila ay mamatay o ikamatay nila to. At malaking bagay din ang pulmonya sa gastos sa isang pasyente. Ang usual or ang typical na cost ng confinement dahil sa pulmonya ay maaaring umabot ng at least ito 250,000 pesos. At kung nasa ICU pa, definitely madodoble, matitriple yung cost nito. Komplikasyon ng pneumonia, marami rin yan. Kaya hanggat maaari, pinitin natin na maiwasan at hindi magkapulmonya at mas madali at mas walang gastos kung mabigyan ng bakuna laban sa pulmonya. Ngayon, kailan o kung kanino ba natin ipapayo na mabigyan ng vaccination? Definitely, sa mga may diabetes, ina-advise na mabigyan ng vaccination. Ngayon, dalawang klase yung vaccines laban sa pulmonya. Meron tinatawag na conjugate vaccine or yung PCV13 at may tinatawag na polysaccharide vaccine, no? PPSV 23, na ang advice o ang payo ko ay pareho itong ibibigay. Pauna yung conjugate or yung PCV13 at matapos na isang taon ay ibibigay yung polysaccharide vaccine. O kung naibigay na dati yung polysaccharide vaccine, hanggat maaari, ibibigay din yung conjugate vaccine at least after a year. Bakit po ganito? Kasi yung conjugate vaccine, mas long-lasting, mas pangmatagalan yung effect niya. Ang problema nito, ang limitasyon nito ay 13 serotypes lang o strains lang yung nalalabanan o naprotektahan niya. Polysaccharide vaccine naman, makikita niyo 23 strains or 23 serotypes yung coverage niya. So, mas malawak yung protection niya. Hindi ganun nagtatagal yung protection niya kung kaya't at least 5 to 10 years ang interval pinapayo na mabigay o maulit itong vaccination na to. And kailangan po natin maintindihan na hindi lang diabetic ang pina-advise na mabigyan ng vaccination against pneumonia. Sa mga Pilipino, basta more than 50 years old, dapat lang ma-vaccinate. Pasyente may diabetes, nasabi na natin kailangan may vaccination, pero bukod sa kanila, may sakit sa puso, halimbawa may heart failure, may atake sa puso dati, may post-stroke, pasyenteng may sakit sa baga, halimbawa may hika, naninigarilyo, may COPD o emphysema, may damage na baga dahil sa TB dati, kasama rin yan sa in-advise na vaccination. May sakit sa bato, may may pasyenteng may cancer, nag-chemotherapy, pasyenteng may HIV o AIDS. So lahat ng pasyente o mga taong mas mahina ang immunity o resistensya, ina-advise na kahit less than 50 years old pa sila, meron silang vaccination against pneumonia. Pero topic natin ngayon, ang ating tutukan ay ang advice na magandang mabigyan ng vaccination against against pneumonia ang mga pasyente may diabetes. Bukod sa influenza and pneumococcal vaccination, isa pang ina-advise na vaccine against for diabetic patients ay yung Tdap or yung diphtheria, pertussis, and tetanus. So again, kadalasan sa mga bata ito binibigay. Kadalasan mga sanggol binibigay kasi lalo na yung diphtheria at pertussis, delikado ito sa mga baby at sa mga sanggol, maaari ito makamatay. Ngayon, sa totoo lang, halos hindi na natin nakikita ang mga sakit na to dahil sa pagbabakuna dun sa mga may edad na rin. So, makita sila, lahat sila protected na, so nako-confer din nila yung immunity sa mga bagong panganak pa lang. Pero pinapayo pa rin na bigyan ng booster ang mga may edad at lalo na yung mga bata o bagong panganak, nararapat na maibigay ito pagkapanganak nila at 3 beses itong ibibigay. Isa pang napaka-importanting vaccination sa mga Pilipino ay hepatitis B. Ang hepatitis B, very common or napakataas ng incidence sa Pilipinas. Ang Pilipinas sa pinakamataas ang incidence ng hepatitis B sa buong mundo. Kaya kailangan o mas magandang mabigay ito para hindi magkaroon ng komplikasyon. So, ang issue kasi natin sa hepatitis B, may mga tao na pag nagkasakit ng hepatitis, makaka-recover, may immunity na sila. Pero may mga pasyenteng hindi nakikilala ng katawan nila na nagka-hepatitis sila o kaya hindi natatanggal yung virus sa katawan, nagiging chronic yung infection at ito ay mauuwi sa cirrhosis o pagkasira ng atay at maaaring mauwi sa cancer sa atay. So kaya maraming may cancer sa atay sa Pilipinas kadalasan dahil sa history ng hepatitis. So advisable din na pagbigay ng hepatitis vaccine. Ngayon, paano na sasari nung nakukuha ang hepatitis virus? Kasama din dyan ng pagtatarik or sex, drug abuse or eye intravenous injections, needle stick injuries o natusok ng karayom galing sa isang pasyente may diabetes o sa pagkapanganak at pagsasali ng dugo. So, body fluids, dugo, semilia, maaaring dito makuha ang hepatitis B. At again, katulad ng sa tetanus, diphtheria, and pertussis, 3 beses ito binibigay at later, ina-advise din na may booster shots para dito. So, ang isang maaaring hindi nyo masyadong narinig na ina-advise din o pinapayo din para sa mga diabetic na pasyente ay ang herpes zoster or zoster vaccination. Ang herpes zoster, ito actually rin yung chickenpox virus na kasi di ba kadalasan mga bata, mga kahit na may edad, nagkakaroon sila ng maaaring magkaroon sila ng chickenpox. Ngayon, ang chickenpox gumagaling naman ang mag-isa. Or para maiwasan ito, nagbibigay tayo ng vaccination against chickenpox. Pero sa ilan, hindi lahat, pero may mga ilang pasyente, halimbawa diabetic at yung mga mas may edad, na yung dati nilang chickenpox o bulutong tubig ay gumigising ulit pag humina ang resistensya nila. Again, sa diabetes, humina resistensya nila at pag na-stress out sila, natitrigger lumalabas yung kanilang chickenpox o bulutong tubig ulit. Hindi na katulad ng dati na buong katawan yung involvement, kadalasan isang site or isang neurologic segment lang. Pero sobrang sakit, sobrang tindi ng reaction, lalo na ng mga edad na diabetic. Kaya hanggat maaari, pinapayo namin na mabigyan din ng vaccination upang hindi ito maging paulit-ulit. Kasi pag babagsak ang resistensya, babagsak ang immunity, natitrigger ulit ito, gumigising ulit, at nagiging paulit-ulit. Once lang ito binibigay, para hindi mahirapan ang mga pasyente may edad at lalo na yung mga diabetic. Yun lang po pala. So hopefully, naintindihan po ninyo na ang mga diabetic na pasyente ay mahina ang resistensya at ang mga diabetic na pasyente ay mas magandang mabigyan ng dagdag na protection upang hindi sila basta-basta magkasakit. At may mga bakuna na ipinapayo para matulungan at ma-prevent ang sakit sa mga diabetic. Kasama na nga ito ang influenza, kasama na dito ang pneumococcal disease, kasama na dito hepatitis B, tetanus, diphtheria, and polio, at herpes zoster vaccination. So, marami pong salamat at kung may katanungan kayo, magandang mas mapag-usapan natin. Salamat po.
Thank you very much, Doc, for that lecture. I'm sure marami pong tutunan yung viewers natin. Actually, Doc, marami na tayong full of questions na natanong sa kanila. Pero to start off, I have my own. Okay. Kasi Doc, in the community setting, we encounter patients who's asking paano sila makakuha ng vaccine? What if nakalimutan nila na nagpa-vaccine sila? Kasi usually, ang alam nila, ang bakuna sila bilang for baby ka or masyado pa lang matanda. Pero yung mga nasa middle yun, kasi pag nakalimutan nila na nagpa-bakuna, pwede ba silang advise na pwede ba silang nagpa-bakuna?
Actually, yan ang tinapay namin na kung hindi ka sigurado sa vaccination status mo, mas magandang manigurado at magpabigay ka ng vaccination. Pero titingnan din natin kasi ano ba yung mga bakuna. Kadalasan kasi sa pagkabata at nung sila ay bata, nabigay naman na dapat yan. Hanggat maaari, o sana na ibigay dati. Ngayon, kung wala sila records, o hindi sigurado, at tingin ninyo, o tingin natin na kailangan mabili yung vaccine dahil sa may sakit na nagpapahina ng immunity nila, mas magandang maibigay ito bago pa man o huwag nang intayin na magkasakit. Ngayon, ang isa lang na gusto natin sabihin ay kailangan maingat lang tayo. Kunyari may sakit sa puso yung pasyente at medyo sumusumpong o matindi yung sakit sa puso na ngayon, huwag muna natin o delay lang natin yung vaccination. Katulad na rin yung dati na sinasabi, pag halimbawa, mataas na lagnat, matinding ubo, hindi natin ibibigay vaccination kasi hindi siya tatalab, kundi dahil baka mag-side effect o magka-komplikasyon or may maging epekto o may maramdaman yung pasyente na maisisi pa dun sa bakuna, kahit na hindi na dapat.
Yeah, that's true. Dok, anong klase kong doktor ang dapat namin konsultahin para sa vaccine?
Actually, lahat naman ng doktor dapat ay sanay at marunong sa pagbabakuna. Pero may mga particular na specialties na mas may kasanayan. Halimbawa, sa mga may edad, yung mga geriatrician, sila, yan, sanay, nagbibigay ng vaccine. Sa mga bata naman, yung mga pediatrician, very familiar sila sa vaccination. Pero anybody, kahit na hindi lang pulmonologist, mga cardiologist, endocrinologist, any physician, actually, dapat sanay at marunong magbigay ng vaccine.
So another question. May bakuna po ba sa Mercury? Yes po, may bakuna po sa Mercury drug. Actually, kung nag-conduct po kami ng annual vaccination program, so all you have to do is ask the pharmacist kung kailan po yung mga vaccination schedules natin to have your annual shots for the flu and pneumonia vaccine. So from our FB Live viewers, from RB of Malate, ang pneumonia daw po ba ay nakakahawa?
Ang pneumonia ay sobrang nakakahawa at ang pneumonia ay maaari makamatay pag mapabayaan o pag hindi magamot at hindi maagapan. Ito ay napakadelikado. Ngayon, ang isang kailangan natin maintindihan ay hindi naman automatic na kunyari na-expose ka sa isang may pulmonya na ikaw ay mahahawa na. Depende nga sa immunity mo, depende sa resistensya mo. Halimbawa, wala ka namang sakit, maganda pa ang katawan mo, kahit ma-expose ka sa mga bacteria o virus, hindi automatic yun na makakasuha. Pero, halimbawa naman, mga pasyenteng may diabetes, for example, o pasyenteng mas may edad na, ito naman hanggat maaari, pinagsusot namin ng mask, pinapayuhan namin na hindi lumapit sa mga may sakit na pulmonya kasi mas madali nga nilang masagap ito at yun, maaaring makuha nila yung bacteria o pneumonia nung kung saan sila nakisalamuha o na-expose. Kaya nakakahawa ito, lalo na sa mga individual na mahina ang resistensya or mas susceptible.
Another question po from our Facebook Live viewer, ang pneumonia po ba ay pwedeng magamot sa batay?
Depende sa klase ng pulmonya o depende sa severity ng pneumonia. Kadalasan naman, kung mild lang yung pneumonia, pwedeng sa bahay lang na bibigyan natin ng oral antibiotic, bibigyan natin ng dagdag na gamot, halimbawa pampatunaw ng plema, pampaluwag ng paghinga, pwede take at pwede ibigay yung mga gamot as outpatient o sa bahay lang. I-advise lang namin na bumalik agad, maaaring 3 days, maaaring 5 days, o maaaring 1 week, para ma-monitor ng gusto yung condition ng pasyente. Pero, halimbawa, ang pasyente ay mataas ang paglalagnat, hinihingal, masakit ang katawan, ubo ng ubo, mas pinapayo namin na i-admit na agad. Lalo na diabetic siya, more than 60 years old. Ina-advise namin na magpa-admit na lang para manigurado na matututukan, mamonitor ng gusto yung paggamot at masisigurin na gagaling. Kasi may mga risk factors yan. Diabetes, more than 60 years old, may mga ibang sakit na pag nag-develop yung pneumonia, mas mataas yung risk na hindi lang ma-hospital, kundi baka makamatay sa kanila pag mapapatayaan.
I see po. Another question po from Facebook user Elaine. Dapat ba ulitin ang bakuna ng flu after a month kung first-timer lang na bakuna?
Okay. Ang influenza vaccination, every year. So, kunyari, nabigyan ka na ng vaccine ngayon, next year na kailangan ulitin kasi may coverage ka na at least for the current strains na umiikot o nagsisirculate sa Pilipinas halimbawa. Ngayon, ang isa lang natin din na maganda maintindihan, halimbawa, nasa Pilipinas ngayon, nabigyan ng vaccination, tapos pupunta kayo sa Amerika after several weeks or several months, maganda rin na mabigyan kayo ng vaccination sa US o sa Amerika kasi ibang strains ang nagsisirculate. May tinatawag na Southern Hemisphere strains and Northern Hemisphere strains. So kung pupunta ka sa taas or sa Northern Hemisphere, dapat meron pa rin vaccination against influenza. But again, every year lang po kailangan ibigay yung influenza vaccination.
So very important, especially sa mga magta-travel natin ng mga suki, important po ang vaccination. So another question po, may diabetes po ako at may sakit din sa puso. Safe po ba kung magpabakuna ako?
Bakuna po para saan? Pero in general, basta naman kontrolado hanggat maaari or actually kahit naman hindi kontrolado yung sugar, even more or lalo pang nararapat na mabigay yung bakuna. May sakit sa puso, nararapat din na mabigay yung bakuna. Ngayon, ang may caution lang o mag-iingat lang po nga tayo ay kung hinihingal ka o sumusumpong na nalulunod ka o hindi maganda kondisyon ng puso mo, malamang sa hindi, i-delay muna namin yung pagbibigay ng vaccination. Again, hindi dahil sa hindi ito tatanap, kundi baka may masising na komplikasyon na pag lumabas, baka ituro ang vaccination. Pero madalas naman, wala ito. So, safe pa rin. Kailangan lang, o mas maganda lang siguro, ma-evaluate ka muna ng doktor para masabi na kaya o walang magiging problema ang pag-vaccinate.
So, pag nagka-pneumonia na po, kailangan po bang magpapakuna na rin?
Actually, very important yan kasi unang kailangan maintindihan natin ay tama nga na ang strep pneumonia ang pinakamadalas na cause ng pneumonia, pero meron pa rin na ibang mga strains ito. Di ba? Strep pneumonia, 90 serotypes yan. Actually, ang protect lang natin is 23 at most. So maraming pwedeng maging trigger ito. And bakit natin binibigay yung vaccine? Kasi more than 30% na ng pneumonia ay dahil pa rin sa strep pneumonia. So maiwasan mo to, ang coverage or protection niya more than 80%, malaking bagay pa rin yan para sa mga may mahinang immunity. And isa rin po kailangan natin maintindihan kasi minsan, di ba, may mga pasyente na nabigyan mo ng vaccination pero nagkaka-pneumonia pa rin. Kailangan explain din po natin na mabigyan ka ng vaccination pero meron pang ibang mga viruses or bacteria na pwedeng mag-cause ng pneumonia. So, hindi 100% protection. Pero ang pinaprotect natin yung mga pinaka-at-risk at yung vaccine ay binibigay dahil sa mataas na incidence dahil sa strep pneumonia ng pulmon.
Actually, we have one question from Susan. Talagang tinatanong nito sa community. I'm a diabetic patient. My doctor is recommending me for pneumonia vaccine and flu vaccine and zoster vaccine. Pwede po bang sabay-sabay silang itusok sa akin?
Usually po yung influenza and pneumococcal vaccination, talagang ina-advise namin na para hindi na magkalimutan, ibigay tag-isang braso. So, yun nga, yung pneumococcal vaccine, once lang naman yan, tapos at least after a year yung susunod. Influenza, every year din. So, para walang magkalimutan at para hindi na ma-delay, ang advice is ibigay sa parehong braso. Tag-isang braso ibigay ito. So, hindi advisable na ibibigay sa isang braso lang pareho, hindi rin ina-advise na sa puwitan ibibigay yung vaccination o sa hita. So, mga bata, sa mga baby, yes, kasi yung hita o yung pinakamalaking muscle nila, pero sa mga may edad, sa braso po ito kadalasan binibigay. Then, yung herpes zoster vaccination, on a separate date na lang probably ibigay sa kanila.
I see, Doc. From Elmer, I am 57 years old, borderline po ang blood sugar ko. Pwede pa rin po ba ako magpabakuna ng pneumonia at shingles?
Yes po. Again, sa setting natin sa Pilipinas, basta more than 50 years old and may risk factors, ina-advise na yung vaccination. Kung familiar kayo sa American o European data, actually sa kanila, ang vaccination for pneumonia, for example, automatic na in-advise pag more than 65 years old. Pero sa Pilipinas, maaaring dahil sa mas mataas yung risk o incidence dito ng pneumonia o maaaring dahil sa lifespan ng mga Pilipino, mas in-advance na. So, sabi ng mga specialista sa infection, sa pulmonary, instead of 65, 50 years old pa lang, ipinapayo nga na maibigay yung vaccination against pneumonia. And then, nabanggit nyo na pre-diabetic o diabetic kayo, definitely or talagang nararapat din na maibigay yung mga vaccination na ito sa inyo.
I see. So, actually, this next question po is very timely kasi meron na tayong mga scare when it comes to vaccination. So, from Julie of Makati, sabi po, may madaming side effects ang bakuna. Natatakot po ako magpabakuna, baka po lumala ang diabetes ko.
Okay. Ganito na lang siguro. Ang pneumococcal vaccine or bakuna para sa pneumonia, 1970s pa yan na-develop. Ang mga ibang vaccination, yung measles sa halimbawa, 1950s, 1960s pa yan. Matagal nang available sa market yung mga bakuna. At napakalaki na naidulot na tulong ito upang mabawasan at ma-reduce ang mga sakit na napoprotektahan ng bakuna. Ang isang pinakalagi natin example, yung smallpox. Kung kayo ay less than 50 years old, 60 years old, probably hindi na kayo familiar sa smallpox. Pero noong 1940s, 1950s, ang smallpox ay nakamamatay at napakarami namamatay nito. Ito ay kapatid ng chickenpox pero mas matindi. Napupuno ng yung mga lesions, yung buong katawan ng pasyente, kinamamatay nila yung pagbabara ng mga lesions na to na maaaring magdugo sa loob ng kanilang katawan. Zero na ang prevalence or incidence ng smallpox sa buong mundo dahil sa vaccination. So, kailangan o malaking bagay at maraming na itutulong ang vaccination. And yung issue sa pagtaas, lalo ng sugar sa mga diabetic, pag mabigyan bakuna, wala akong katotohanan yan. At mas magiging problema niyo na magkasakit kayo halimbawa ng trangkaso o magkasakit ng pulmonya, yun ang nasisiguro natin na magpapataas lalo ng inyong sugar pag magkaroon kayo ng sakit. Kaya mas maganda na ngayon na wala kayong sakit o walang karamdaman, dapat na pabakuna na kayo para madagdagan ng protection. Nakompleto ba natin? Baka may tulong pa din sa tanong niya.
So far, na-cover naman po yan. So, another question po to. We have two strains kasi po na influenza. We have the trivalent and yung tetravalent. So, when should a person have a tri and when should have quadrivalent?
Actually, mas lumang klase kasi ng vaccine for influenza yung tetravalent. Yung trivalent. Ang trivalent, ibig na sabihin, tatlong strains or tatlong serotypes yung naproprotektahan niya laban sa kanya. So, ang tetravalent naman, 4 na strain. So, mas kompleto o mas maraming nabibigay na protection yung tetravalent vaccine for influenza compared sa trivalent. Totoo na mas mura lalabas yung trivalent pero nga kasi mas bawas o kulang or limited yung protection na nabibigay niya. Hindi katulad ng tetravalent na 4 na strains o 4 na uri ng influenza virus yung napoprotect niya. Kaya kung magpapabakuna kayo, mas advisable na yung tetravalent vaccine ang maibigay.
For our last question, yun nga, hindi talaga nawawala yung mga takot magpabakuna. Fear nandun pa rin yung researchers. Pero long as a pulmonologist or the leading experts data, how do you convince your patients to have their vaccination?
Ang una-una kong sinasabi ay mas maganda at mas mabuti at mas maigi na mabigyan sila ng proteksyon kaysa sa intay nilang magkasakit. Yan naman ang main concept ng vaccination na para hindi ka magkasakit, bibigyan ka ng vaccine na hindi mo na iintay na magka-pneumonia ka na magka-trangkaso o influenza ka na bago ka mag-spread. At hindi naman sa lahat automatic ay a-advise o ipapayo natin. Meron lang particular na mga groups ng pasyente. Again, more than 50 years old, diabetic, may sakit sa puso, sakit sa baga, sakit sa bato, may mga cancer, may HIV o AIDS, natanggalan na ng lapay o ng spleen. So ito ay mga halimbawa ng mga pasyente na kahit na less than 50 years old, dapat bakunahan. More than 50 years old, automatic na dapat ang protection nila. Again, mas maganda at mas simple na mabigyan ng protection kaysa sa intay ninyong magkasakit kayo. Mas maraming magiging komplikasyon, mas magastos yung magkasakit bago mabigyan ng vaccination. So,
Yes, I think, Doc. Thank you very much, Doc. I know marami pong natutunan ng ating mga viewers and I know maraming naninawan when it comes to vaccinations at diabetes campaign. So, totoo po na madalas talaga nakakaligtaan ng ating mga diabetic patients ang importance ng immunization. Kaya sana po ay tinandaan ng ating mga suki ang mga paalala nito. So, ayan po. I know, yung mga recap natin, pwede po i-recall itong video na ito, just like this video, share this video, para po mas magkaroon ng wider range ang mga viewers natin, para rin po magkaroon sila ng knowledge when it comes to vaccination and the importance of diabetes management. Kaya, mga suki, thank you for tuning in our Diabetes Care Lecture Series. This is brought to you by Get Well at Mercury Drug Diabetes Care. Please watch out for our next set of lectures this July. So, again, this has been Mikey, and I'd like to thank you all for watching our Diabetes Care Lecture Series.